My name is Akhil, and I am so pleased to be with you all today and to be presented with the opportunity to introduce our guest speaker for today, Dr. Gopakumaran Kartha. Dr. Gopakumaran Kartha, presently the Dean of DM-WIMS, is an accomplished doctor with more than 30 years of academic experience in medical physiology. Dr. Kartha has been awarded the best teacher on numerous occasions and has organized and been a speaker for many conferences and CME programs in the state and national level. Today, there is no better doctor, a better academician, a better person to speak on how to transform from an ordinary, undisciplined student to a role model of a doctor, which is today is all about. Ladies and gentlemen, without any further ado, let please join me to welcome the chief guest and speaker for today, Dr. Gopakumaran Karta. Doctor, please.
Hello, everyone. Good morning to you all. First of all, I'm so thankful and grateful to all the nice words that you have expressed on me. So this is a very an informal session where we are actually going to discuss some of the important aspects about transforming an average medical student to a better doctor. So the title is A Journey from Dunce to a Doctor. Don't worry about the title, please. This is something, a self-reflection about how I was actually in my school time and turning into a medical student and thereafter into a faculty level. Of course, I was a very average student in my school time. And the turning point started in the high school when some of my relatives pointed out that my father was totally depressed and tensed because of my poor academic performance. Of course, this was told to me by one of my aunties when they visited my house on the sad demise of my father. Add on to that, my elder brother was very studious and very systematic, meticulous person. So that was definitely added to my burden. So from the high school onwards, I started thinking myself, was me responsible for the stress that face my father? And more than that, my auntie compared myself with her own son and asked me to follow his path. And he's a very studious student. And that was actually a real, a blow that then thereafter I decided, okay, let me have a healthy competition with my own cousin who was of same age. At last, we both wrote the entrance together. Fortunately, because of the God's grace, maybe the gift of my hard work, I got into a government medical college in Kottayam, whereas my cousin got agriculture in Trivandrum with a lesser rank. So there is no comparison at all, because this is the story of a dunce, you can call, an average schoolboy turning into a medical student. Hope this will be an eye-opener to many of my young friends. So it's always indeed a pleasure to discuss some of the important academic essentials with my young friends, those who belong to first MBBS. I'm pretty sure that majority of the audience belonging to the first MBBS recently joined in the medical school. As you know that there is a 180-degree change in the curriculum. The medical education by itself totally changed, you can say. The medical education became more accountable and the medical student become more measurable. And of course, there is a change in the medical curriculum into a competency-based one. That means on every year, there is set competency to be attained by this medical student. Every subject, every chapter is having a measure or a parametric analysis of competency. So there is a lot of change that is happening in the medical education. And of course, at the end, you will be having a next examination based on which you are going to have licensing. And from third year onwards, you will be having an electives, you will be posted outside in some of the related specialties of your choice. Early exposure to clinics, even from the first year onwards, or from the first month onwards, you are getting exposed to the medical practice and all. So altogether, there is a significant change in the medical education in the country from 2019 onwards. So it's very essential to have a roadmap of how you cope up with this extra strain or extra stress in the medical education. Already there is enough, but how to solve this out? How to make your own path? How to make your own portal of exit to come out from the stress? That will be the major discussion today. I repeat that this will be an absolutely an informal talk. At the end of this, you can put your queries and we will try to have a discussion and we will reach an effective solution for each and everyone. And you know that the medical education or MBBS course by itself is 4.5 years plus 1 year internship. Of course, in the first professional, of course, that major burden, you have anatomy, physiology, and biochemistry that to be done in 1 year. Definitely, it may not be 1 year. The admissions getting delayed by 1 or 2 months usually, and hardly you will be getting 9 to 10 months of productive academic year in the first year. It's okay, reasonably good. Now, second professional, pharmacology, pathology, microbiology, and forensic medicine and toxicology, where you will be having the theory of these things, plus you will be getting exposed to the clinical scenario. That too, in 1.5 years, it's okay, no problem. Third professional, yes, you will be having some clinical subjects, ENT, otorhinology and rhinology, ophthalmology, and community medicine. It can be done in 1 year. It's also an easy task, you can say. But fourth professional MBBS, you see, there are 9 different basic medical subjects, starting from general medicine, general surgery, obstetrics, gynecology, pediatrics, orthopedics, psychiatry, radiodiagnosis, dermatology, and anesthesiology. See, it's a vast area to be covered. How much time you get? That's very important. You are getting only 1 year. This is the major problem that is going to be faced by an average or above average, you can say, medical student. How to cope up with this? Within 1 year, you will be having all theory, plus you will be having seminars, small group discussions, clinical postings, OP, IP, ICU, emergency medicine, and whatnot. How to solve these things? This is a major problem. I told you, this is the one important key thing you should keep in mind as you enter into the first MBBS and later progressing into the second professional and third professional. Make your early steps very firm and strong that you will be able to cope up with the large subjects that you are going to face in the final year. Once you make your anatomy, physiology, biochemistry, and progressing into the second MBBS will be easy because most of the things are going to be applied. Most of the things are going to be extrapolated from physiology to general medicine. Most of the things are getting projected from anatomy to general surgery, orthopedics. So all these basics subjects are so important in the first MBBS. The relevance you are going to find in a retrospective way when you go to the final year and the subsequent years. So my humble request to my young friends, make your first year, second year very strong and firm, and the rest of the journey will be very easy for you in your clinical postings and in the clinical situation. Now, what are the 3 important things, 3 Ds to be remembered as a medical student, or in fact, going to be into a doctor status? 3 Ds are nothing but dedication, determination, and discipline. Now, this is not a unique thing only for the medical profession per se. This is applicable for any professional course for that matter, or any of your profession that you choose. Now, what do you mean by dedication to your profession? This is actually a cartoonic representation. One should be dedicated to your priorities, dedicated to your responsibilities. You know that the medical profession, the doctor profession, the most important hallmark, how this medical profession is different from the other professionally related course, because we have to have utmost commitment, utmost dedication to our profession. There will be a lot of festive occasion that is coming in your family, coming in your house, coming in your institutions. But most of the time, you may be forced to say no to these things, and you have to be there in the workplace when the patient needs very badly about your presence. So dedication, there is no substitute, no replacement for this attribute in the medical profession. Now, what are the important major distractors a medical student can come across to be faced or to overcome? Of course, the first and the foremost one I observed in last 30 years of interaction with my young students is the homesickness. Food is a major distraction for them because they are moving from their home into an institution where they are going to have food from the hostel or food from outside and all related problems. Ambience is totally different in the hostel, in the campus. The ambience that you are enjoying in your home, it is totally different what you are getting there in the institution. Of course, a strange atmosphere and people. No, you are actually in the hospital. You are there among the doctors. You are having the paramedical staff, new friends, strange friends, totally different atmosphere compared to what you had in your school time. Academic stress, you know that, yes, it's almost 19 subjects within a span of 4.5 years, and that too, a large, massive subjects in the first year itself, 3 subjects. Definitely, it's going to create an academic stress. More than that, it will be frequent evaluations. You are going to have ongoing evaluation every month, almost every 2 weeks you are going to have. All these will add on to the academic stress, no doubt about it. Now, this is another very important thing. See, medical schools, especially in the first year, most of the students are actually coming from the cream of cream. Most of them will be the toppers of the district, toppers of the school, top of the institution, and they may be rewarded and awarded in occasions. And your parents, they are very really proud, and there is no query or no doubt about their academic competence. See, their bunch of students are coming into a same class. Definitely, there will be a competition, and the topper who are actually enjoying all these extra privileges in the school may not get in the true level when you are there in the medical schools, when there are so many toppers there in the class, so many toppers there in the institution. So this will be a problem most of the first year MBBS students are facing. Now, a very, very evil thing that is to be addressed and that's to be eradicated from all the professional college is nothing but the ragging. Now let us take the one by one. Homesickness. See, this is one of the major problem that we face as faculty in medical college, especially in the first year. Of course, they may come out from this particular problem maybe within 2 to 3 months, but that particular period is so crucial as far as the first MBBS students is concerned. I told you the course may be delayed by 1 or 2 months. Most of the faculty members in the first year level, they will be rushing through the topics maybe in the first 2 to 3 months. We cannot afford to look into the learning lag of the students who are coming from +2 to medicine. We have to finish that particular portion within that stipulated time. Most of the faculty are in a rush to complete a significant large amount in the first 3 months. And unfortunately, during that particular period, most of the students, majority of the students in the class are distracted because of all the points that we discussed in the earlier slide. One of the top is the homesickness. The major problem what we face here, towards the weekend, most of the students are having a mindset to go back to their home. And they are actually having all these good memories. What are the tasks? What are the important things to be shared there with the family once they reach back to home? That preparation will be going on there in the mind and the brain when they are attending the class. They may not be able to give the 100% attention or 100% concentration in the class, especially towards the weekend. And what happens there at home when they go back, because of a lot of events, a lot of good things to be shared, a lot of bad things to be shared with their near and dear, that will take nearly about 1 day at least. And that will be the situation. Then they will be having some visits to their relatives and all. And just before closing the vacation or closing the holiday, on the next day, in the early morning, in the next working day, the early morning, they reach back to the campus. They are totally distracted, totally disorganized because of all the thoughts, all the memories, good memories that they got from their home. and that will be having a hangover for about 2 to 3 days in a week. So in fact, they will be having a peaceful mind or a concentrated mind, especially in the middle of the week. So this is a major problem what we face in the first year. So it should be a collective task, a collective consensus to be what you call drafted from both the student side, faculty side, as well as from the parent side. So parents should have a clear-cut discretion about what is the frequency of the visits of their ward into their back to their home. My humble advice is once a month is quite optimum to have a home visit. Maybe in the second Saturday, most of the institutions are having holiday on second Saturday. So on the Friday weekend, the student can go and they spend Saturday and Sunday, the whole day. Towards the evening, they should reach back the home so that they will be mentally prepared from the Monday onwards. All the backlog of their homework, assignments, all those can be done on the Sunday evening when they reach back. And then they will be getting enough breathing space to reset their mind back to their academics on Monday itself. So this is one solution that I can put forward to my students as well as to the parents to come out from this particular problem. Now, the food. This is the major problem, especially most of the students who are actually coming from the outside the country in the NRI quota and all. Majority of them are actually having a comparison with the food or the dishes that they had there in the house. Of course, when we are having what do you call a mass kitchen where the foods are being cooked or prepared for more than 1,000 students, including the faculty as well as the staff. So it's very, very difficult to maintain that particular taste or the I cannot say it's a quality, that particular taste to their dish. So students should accommodate this particular fact. Now, I'll tell that you cannot completely ignore the quality. The 5 important attributes of the food, the students should be more concerned, forgetting about the variety that they are going to have on every week. The quantity is very important because they are all growing children. They need a lot of brain work, a lot of intellectual exercise going on. So they need enough calories. So quantity, there should not be any compromise. And it cannot be accepted at all. Hygiene is the most important thing. The personalized hygiene and the cooking area, everything to be properly monitored and having a good surveillance on it. Nutritional value of their dish. When they plan their menu, they should not compromise on the nutritional value of their diet. The quality, to a certain extent, we should preserve it, and palatable, should be tasty enough. And I humble request for my young friends, so don't get more focused on the variety of the food they are getting on every day, but you should be much, much concerned about these 5 attributes as you see there in the slide. Now, this is another important thing that I observe there in the hostel and in the college premise. Of course, you are moving from a well-organized homely atmosphere to the hostel or to the campus. And I have seen that the macro majority of the rooms in the hostel are absolutely disorganized. Now, I'm not actually trying to find fault here. This is a major problem. You will not be having a peace of mind or a mindset to sit back in their concerned room and prepare for your daily lessons or the examination. You will be always having a temptation to move out. You will be wandering there in the corridor. You may be using the common reading room and any place there in the academic block. See, as our institution, we are opening every space for the student to prepare and study, but that is not a healthy habit. So you should sit in a particular place where you organize things around you and you prepare, and where your timetable is being put up or stuck onto the wall and all. So always your familiar environment, you can learn a lot, and the effort of learning also will be reduced. And more than that, you can see here, the heat of disorder or the entropy is much more in such a room where the things are actually in a disorganized way. And if you think, your brain also can assimilate things, encode things, coding into the memory of facts, all are actually going into the brain in a very systematic, organized way. So our body is accustomed to it, body is tuned to it. So sitting in a place like this where things are so haphazard and so disorganized, of course, you will take more time, more extra effort to study a particular given topic compared to a situation where things are very well placed and organized. So this particular thing, every student should keep in mind. And the parents also can look into such things. Ask them to take a snap of your room and send to the WhatsApp, so you can have also a surveillance or a monitoring of the places. So this is a one solution you can come out from the distraction that you get in your medical first year medical education. Of course, the atmosphere is totally different. You are encountering, you are interacting with the different people there in the class. Majority of them are actually coming from the state, of course, but from the different socioeconomic status. And almost a sizable percentage of students are coming from abroad, coming from outside the country, having a different educational background, different socioeconomic background. So you are going to interact with all of them. So one should be very choosy about the friendship that you make. In the coming slide, I will show you what are the important things that you should keep in mind for the selection of friends. So every person will be having their own whims and fancy, their own priorities, their own interests, their own inclinations and all. So never ever try to annihilate, never ever ever to question their personalized things. So get along within a healthy way. Find out at last, find out a group of students where your thinking wavelength is exactly coherent, and all you are having a progressive thought, a positive attitude in their medical education. So selection of your friends is very, very important. So please keep in mind, you are not going to have a homogeneous crowd around you in a medical scenario. You are going to have different people of different caliber, different educational background, different family background. So get along with everyone in an optimum way. That is really an art of survival, an art of living in a medical education. Now, of course, this is the academic stress. We are all responsible for it. The medical education per se is responsible for it, because first year is too much for a student coming from the +2 level, and at their tender age, anatomy, physiology, biochemistry are too big subject to cover in 1 year or maybe less than that. And here one should keep in mind, never ever get fascinated by your percentage or grade that you get in the examination. Of course, you should have a good percentage, but not get focused on your 90 plus, 99 plus, 85 plus. All those things are actually one of the important targets or one of the important criteria of the students of +2 level. Here, the most important thing in 4.5 years, what information that you gather, what skill that you acquire, what other ability like communication, the values, what are the things you imbibe during this 4.5 years of period. That is very, very important, not your percentage or the marks. So you just ask your parents. Many of them may be doctors, maybe having a good practice, maybe a cardiologist, neurologist, gastroenterologist, even a nephrologist. Are they remembering their marks they scored in anatomy or the marks they scored in physiology? Of course not. But they became good practitioners, good consultants, good clinicians only because of the knowledge or the cognitive elements that they assimilated in the 4.5 years period. So don't get what do you call much focus. Don't be taken away by the percentage of marks or the digits that you are getting across your name in the mark sheet, but study the subject thoroughly. Find out the relevance in the topic, correlate with the clinical subjects, acquire maximum knowledge, your academic excellence, the percentage, the grade, first class distinction, everything will come in place or it will fall in place. But don't go with the percentage mark alone by compromising the major topic. So you will be having an interest to go to small books to get good marks. That may be the advice that you might have got from your seniors. There are small gates available there made by the medical students. Of course, they are really good. I'm not finding fault with that, but that alone will not help you. Of course, it may fetch you more marks in the university exam, but in a medical education or in an MBBS curriculum, it is not the mark alone. It is the knowledge, how to interact with the patient, how to corroborate your clinical findings, the methodology of examination, interpretation of your clinical investigation. Everything really matters. So a holistic study, a holistic approach to the subject is very, very important, not by getting marks. Now, unhealthy competition and comparisons. This is another important problem that we face in all the years. I told you, when we are getting the medical students or admissions over, most of them, more than 90% of the really cream of cream, they are really toppers, but never ever try to compare with yourself to another student. There may be very fast learners there in the class. There may be moderate paced learners, or it may be a slow learners. So don't try to compare with your learning skill with another person. I remember in my own college time when I studied in Kartha Medical College, I was having a friend there in the first MBBS. I'm not disclosing his identity or name, and he never ever studied in any of these things. And on the very day or the very same day of examination, he gets up at 6 o'clock. He will actually keep his what you call bed sheet over his head, and inside that he will just turn the pages and study. And when the marks comes, he gets almost 70% plus. And there are actually students having a different learning skill. Some of them are having really a magnetic memory. There is no need of them to put maximum effort. Don't try to compare with them. So you find out your own learning skill, your own capacity, and try to be as you, and never ever try to equate yourself with anyone. And more than that, never ignore a slow learner in your class. This is very, very important. Majority of the students are actually average, but minority are what are you having a lower pace. Don't try to ignore them. A topper student there in the class, definitely you can help your peer who is having not that much of pace. So give a small academic task for them, and discuss with that with your friend, and find out how much you have learned, how much you are actually going to represent there in the university exam, or maybe in the sessional exam. So such academic discussion can take place even in the mess hall, or even there in the corridor. In addition to what the loose talk that I'm not telling that don't have any loose talk, enjoy your life, enjoy your college period and all. At the same time, just give some sort of academic discussion also there in your group discussion, where the slow learner will be benefited to the maximum. So definitely go into a win-win situation. You know that teaching is the best way of learning, and not by compromising your own learning time. At the same time, definitely it will boost up, or it will facilitate your interpretation, your expression, your conceptual learning and all, when you discuss the same thing with your friend who is not very familiar with that particular concept. Now, another important thing, every first year student is undergoing in the first 3 months. Of course, we are all concerned. The law enforcement agency is who concerned. There are so many agencies in the state level and the national level, and also in the institution level operating to remove or to erase this particular what you call barbarian act of ragging there in all the colleges. But still, some remnant are always there in some of the institutions. But my humble advice is, and never ever actually get panic to this situation. Never ever lose your peace of mind because of this the evil which is there in the campus. And to a certain extent, asking your name, your rank there in the NEET exam, something about your family, something about your hobbies, something about your interest, your academic status in the class. All those things will be inquired by your seniors in a very healthy, positive way. View that thing in a positive way. Consider that they are all well-wishers, and treat them as your seniors. Give respect and get respect. But at the same time, be very cautious. They are not allowed to cross their limit. And if they are crossing the limit, don't hesitate to report to the most accessible faculty member in your institution, or there is an anti-ragging committee in your institution. And without revealing your identity, you can complain to the head of the institution, or to any faculty member or any responsible authority there in the college. That also you should keep in mind. At the same time, never ever get more sensitive, or never ever get intolerant to a healthy attitude or a healthy approach from the seniors regarding these things. So that will take away a lot of your tension, and you will be able to concentrate the studies from the beginning itself. Now, the second thing is the determination. This is one important thing I want to stress, or I want to share with my young friends here. Never ever get disappointed in this particular period. Of course, you may be near the tunnel, and a few centimeters is just enough to reach to that particular destination of your choice, or maybe the goal. And which are the areas where you will get what you call distracted, or will get fed up. Now, suppose a particular concept which is so complex and which is easily understood by your friend, and you are reading and reading and reading, you are not able to get the crux of it. Don't get disappointed. Read it in a multiple way, and you can discuss this matter with your mentor or the faculty who is so accessible to you. As I told you earlier, you can discuss with some of your good friends or the topper there in the class and find out this thing. Never ever get disappointed. No, never ever leave this particular matter in between. Another thing, when you go to the clinical side, some of the murmurs or some of the abnormal sounds that is coming from the heart, you may not be able to interpret it. You may not be able to pick it up. Some of the clinical signs, some of your friends, you got it, you may not be getting it. So don't get disappointed. So use a repeated examination, change the clinical skill of examination. Again, you can seek help from your immediate senior, or maybe they're in the postgraduate student in the department, or maybe the middle level or the lower level faculty in the department, or some of your friends got this particular sign. So you can discuss with them and find out it. So my humble advice is never ever give up. And especially for your NEET PG examination, the first attempt you may not get your choice of a post graduation. Repeat it. Definitely the success will be for you. Now this is the most important thing. Remove the T from this and you can do it, and we are all equipotent to get the opportunities or to get the success. Now what are the easy way to be determined? Now you can have short-term goals and even the long-term goals during your period of study. What do you mean by short-term goal? You can say that I'm going to study this much portion in anatomy, physiology, biochemistry, or any other paraclinical or clinical subjects on this particular day before I go to the next class. Next class may be after 2 days or after 3 days or maybe in the next week. So you please make a short-term goal. I am going to cover this particular area or this particular portion before I go and attend the next class. Or I will be a master. I'll do all the correct way of examination before the next clinical examination or clinical practical class. So such short-term goals you can keep it. What are the long-term goals you can set? Of course, in this particular month, I'm going to cover one particular system. For example, I'm going to cover the gastrointestinal system from physiology, or I'm going to study all the structures in the forearm or maybe in the hand in this particular month. And these are the long-term goals. Or I'm going to attain a 70% mark in the first sessional, 80% the second sessional, and I'm going to get all the distinctions in all the 3 subjects in the first year. So you can have your own short-term goal and long-term goals. Mind you, it should be proportional to your intellectual capacity and your own ability. Next is observe and interact with the role models in the class and faculty. This is a very, very important thing. Unfortunately, the role models from the faculty are slowly coming down. That is the observation that I'm having the last 10 to 15 years. But in my period, there were a lot of role models in all the clinical subjects as well as paraclinical and preclinical subjects. Now, the number is gradually coming down. So I think all the faculty members, you should rethink about it. How can you be a role model in front of your students? Because mind you, they are actually going to imitate you. They are actually going to imbibe a lot of qualities from you. We are the immediate masters for them, especially how to interact with the patients, how to elicit a clinical finding, how to interpret an investigation. All these things, the students are closely observing us and they are going to learn a lot of things from us. So all the faculty members should be conscious about these things. And there are some students there in the class, they are real role models. They will be having an absolute blend of every attribute of a medical student. They will be very systematic, very organized, very clean, very level-headed, and all those things are actually, few students will be there in the class. I was having a role model in my college time, especially during my period. She was actually the first rank holder in the 10th level, pre-degree, then entrance. So many of our students, many of our classmates, many of our friends are actually kept she as a role model, and many are actually trying to imitate first, and then we will inculcate quality from such a student. So find out some students like this, some of your friends like they're in the class. First, you observe them, how they are actually approaching towards this particular course. Then try to imitate them, and slowly, once imitation continues, you will be inculcating a lot of qualities from them, and it will become a character in all of you. Another thing is you can keep some motivating quotes and pictures in your study area or in your just above your bed, and wherever you are actually seeing almost every day or frequently you are seeing that particular thing and get motivated by seeing this group study, which is slowly disappearing from the medical education nowadays. But when we were students, individual studies are very less. It is always a group study. What are the advantages of group study? Definitely you will be involved in the common attitude of that entire group. But the selection of group is very important. Find out the group who are having almost the same pace of your learning ability, your interest, all are progressive. They are having a priority in about their career and about their academics. So find out such a group, 3 or 4 maximum number, then sit together and divide the portions among that particular group, and each person will be studying one particular area and then they will be discussing. For example, blood. I'll quote a topic from my own specialty. You can take blood. So you make a 4 groups. So one person can study all the related things, physiological essentials of RBC. Another person can study everything about the WBC. The third person can study everything about the immunity. Another person can study about the hemostasis or the blood clotting. And finally, you are grouping together. And one of the person is actually sharing what they conceived or what they studied in that area. And then you can discuss the questions. So this is actually the group dynamics about the studies. This is very important as far as the group study is concerned. Sometimes there may be one person is getting slowly distracted, and don't allow that particular person to take away the group interest or the priority. The others can group together, or others can have a comment that, yes, you are actually distracting, come down, and we will actually coming back to the studies and we will progress. So these are the way by which you can bring a slow learner also into a group, and they can also bring some academic excellence. Then, as I told you earlier, always the teaching is the best way of learning. Identify the slow learner, approach and ask them some questions, give some academic tasks, discuss or bring them into the group and discuss the important complicated things with them, so that they will also getting lifted up in the academics in the class. Now, another one is discipline of the third D. This is a very important thing, because you are moving from the +2 level. Your academic ambience is totally different here. Here, you are the master of your time. You are the master of your knowledge. You are the master of your skill, and you are master of your habit, because you are away from the home and you are actually there in the hostel. As I told you, you are surrounded by the students or the friends of different thoughts, different attitude. So a self-discipline is very important. You should have a clear-cut roadmap, clear-cut priority. What am I supposed to do in the next 4.5 years? What is the purpose of reaching there in this thing? And how much dreams or how much expectations your parents have invested on you, and the relatives are actually how they are looking upon you. All these things should be your concern, and what do you call adjust the priorities, bring the priorities into your life based on these things. Now, what are the easiest way to be disciplined? Number one, as I told you, always you should be self-accountable, and you are actually a grown-up now. So medical education or a medical school is an adult learning scenario. A faculty cannot always be behind you to enforce the discipline and all. So self-accountability, self-discipline is the most important thing that we expect from you. Selection of your friends, that's very important. As I don't want to go into the intricate details about the activities going on there in the hostels and other parts in the campus, but we are all concerned about these distractors. These are the social evils that is happening in the college or in the campus. So when you are selecting your friends, be very cautious, very selective, very choosy in that. Find out the group or find out the friend who is having almost a same set of interest, same progressive attitude, same inclination, same priorities. That's very important. Then there is no harm in rewarding yourself. Suppose you have attained your task, your objective is fulfilled at the end of the day or at the end of the week. You got a good mark there in the sessional exam or in the formative assessment. Don't actually hesitate to reward yourself. Stand in front of the mirror and admire yourself. Yes, you have done it. Or you can share these things with some of your well-wishers of your relatives, your parents. So the parents also can reward them. However, the trivial, their success may be, but there is, please don't be stingy towards the rewarding. and you can reward yourself. It's absolutely, it's a biofeedback. You can improve. The money management is another very important thing that will create a lot of problems. And once you have a discipline in your expenditure and the money management, I think more than 60 to 70% of your problems will get solved. See, unaccountable money coming to you, coming for your disposal, that may be one of the major distractor, major negative impact on your studies. And I will go into the details about the money management in the concerned slide. Skipping classes is very, very important. Of course, many of the theory classes may be really boring, and you feel that you may not be able to get maximum things that you expect there in the class. But auditory learning, or somebody is talking and a particular concept, somebody is sharing their experience. When a doctor is coming and taking a theory class, of course, the theory part you can get it from the standard book or maybe as a reference, but the experience he or she is going to tell there in the class, he or she is going to share with you there in the class, which cannot be substituted or which cannot be assimilated from any of the textbook which is available on the globe. So try to be very, very concerned about skipping classes. Now, for practicals and the clinical posting, see, very essential. Every clinical posting is unique. Every OP exposure or outpatient exposure is unique. Every surgery is unique. So if you're missing a clinical scenario class or a clinical setting or a clinical discussion or a bedside teaching, emergency department bedside teaching, if you're missing, I'll tell you, you missed it forever. You are not going to have the same scenario again. I'll give my own example. I have seen only one diphtheria case in my entire life. And that too, a son of a doctor. When I was in third year, I saw this particular case with the patch there on the tonsil. Thereafter, I have never ever seen a diphtheria case in the rest of my college or during my post-graduation. So if you're missing one particular clinical case, that may be the first and the last case you may see there in the class. Of course, the video may be there in the YouTube for that particular disease, but the good diagrams or good pictures may be there in the standard book. But that is not a replacement of a live or a living patient coming with that particular expression, particular body caricature right in front of you, narrating their complaint and the problems, and the doctor is interacting, doctor is finding a solution for it, how the doctor is examining it, how the doctor is drafting the prescription or the management, that you are going to get only in the real-time situation. So my humble advice is never ever miss a practical or maybe a clinical class. That doesn't mean that you can skip all the theory classes. That is also very precious, and that cannot be substituted to the full extent from the library or from any other medium. Now, seek help from the mentor. Definitely, this is one of the areas where the first year students should be so concerned. And the second year also, you can find out. Of course, many of the institutions are having their own mentorship or mentor system. Even the KUHAS, Kerala University of Health Sciences, is giving this particular instruction. Every institution should have a mentor. That doesn't mean one particular teacher or faculty who is coming very close to you. He is actually showing interest in an overall development of a medical student. That is the concept of mentor. And you should exploit it. You should extract this facility from your side to the maximum. Once a week, you can go and see the mentor, or the mentor by himself is giving a schedule for it. In some of the institutions, we are having a definite fixture for interacting with the mentor. The mentor will be completely cross-sectional analysis about your academic performance, non-academic stress, and other personalized things they will be sharing in a very objective way, and giving a report to the head of the institution almost every fortnightly. So utilize this particular facility, disclose, come out, communicate to your mentor, open up to a mentor, discuss all your problems so he may be able to find a solution for it. So never keep your problems within you. Don't try to brood up things, and that will definitely kill your what do you call a positive attitude and good days in the academic life. So each one I told you, self-accountable, as I told you, you are the master of everything there in a professional education, like in a medicine. So you are accountable for your knowledge that you acquired. You are accountable for your time. You are accountable for your money, and you are accountable for your skill development. So almost 70% of your self-directed learning is very, very important. At the same time, think about the other aspect of your life. How much quality that you have acquired. What are the ill qualities or ill feelings or ill thoughts that you erased from your mind? All these are very important self-accountable fact you should keep in mind. Then As I told you, selection of friends, very, very important. And if you are choosing friends of not your choice, not your temperament, definitely you are going to lose a lot in your medicine profession, because you are going to be a hostler for the next 4.5 years. The friends that you chose in the first year may not be the same in the second year or third year. It will be always changing. Your vision is changing, your attitude is changing. So find out a group of students always around you. They are supportive, they are progressive, and they are keeping you in the correct track. That is very important as far as a medical student is concerned. As I told you, rewarding, this is very, very, very important thing. And most of the time, you may not be able to share your feelings with your friends, or maybe however they are intimate to you, may not be able to find out a good faculty member whom you can share all your achievements. They may not have enough time, but you can have a self-rewarding things on everything. Or you can keep a piece of paper, write important tasks that you attained in every day or in every week or in every session. Put a tick against each one that you acquire it or that you gather it. That will be definitely a biofeedback where you are rewarding yourself. That will be definitely a progressive to come out further. Another thing is money management. I told you, you are actually in a receiving mood. You are getting money from your parents or maybe from your relatives, and you are spending. So one should be very, very judicious, and your economics should be very simple and very progressive and very positive. So make your expenditure weekly basis or monthly basis, and you assess yourself. What are the areas where income hemorrhage occurred? What are the unnecessary expenditure that you have done? And reassess yourself. Of course, as immediately after moving out from your family, having a self or independent existence where you are getting a freedom for money transaction and all, you may make mistakes. I'm not finding fault with it, but you should correct from the mistake. Next month, you should what do you call, seal all these abnormal portals of income loss and try to be much more careful in that. There are a few tips I can share with you. A very costly reference book. Of course, it may be available there in the library, but if you want to have your own in your possession, make a group of who are actually having a same interest, share the money and get the book. And once you finish the course, you can sell the same thing in a second-hand price to the first year level. So this is one way of getting back your money. And an atlas, which is very costly, may not be able to possess by yourself. Make a group, share the money and get it. Similarly, bond set in the first year, you may need a full bond set for your own studies and even for your further studies in the orthopedics and all. And you may not be able to afford by yourself. Make a group and get it. And find out a good area where you can dine out, where the food is so cheap and also at the same time very clear, very clean and with hygienic. So there are so many areas near around you. Find out some areas where you can have dine out. That will definitely fetch you a lot of money rather than spending thousands and thousands of money there in a five-star hotel where you are grouping. The distraction also will be more in that particular ambience. So these are the few things that you can get. And if you're so smart enough, there is no harm in finding out your own income generation. You can have a medical transcription side time if you have enough time, but not spoiling your academics. That's very important. You can generate income. You can have some blog-like thing where you are sharing your. I've seen so many blogs by the medical student. They are sharing their own experience, sharing the learning tips, how to be a good medical student, and all those things. You can have your own blog where you can get some income, and you can be a presenter or maybe a moderator in some of the online learning platform where the subjects are being discussed. So there are so many avenues where you can have your own income. Think about it. If you are so confident, not by compromising academics, that's very important. Another thing is, I told you the skipping class, I told everything about it. Skipping, how much you are going to lose by skipping a theory class, how much you are going to lose by skipping a clinical class or a practical session, and all those things are very important. I'm not saying that all the theory classes are very, very, informative, very, adjustable. You can easily accommodate all the. I'm not actually having that particular utopian idea. Each faculty are different in their caliber, in their conduction of classes, and of course, but there will be some element that you are going to get every class. I am 100% sure about it. As I told you, this is one very important thing in a long-term journey of 4.5 or 5.5 years in the medical profession. Find out a mentor who is so accessible to you, so supporting to you. Share everything with him, and so that a lot of help that you can get from the mentor. So try to find out a mentor. If such a system is not there, you can request to the head of the institution to have a mentor system there in the college. Definitely, at least for the first years, second years, till you get into the groove of medical education. Now, towards the last thing, how to prepare for exams. What are the important obstacles? These are all things that I got from the feedback of the last 30 years from my students. The learning lag that you feel or you pass through after the post-NEET. You can say that a post-NEET lethargy or post-NEET inertia that you get. Voluminous topics. Of course, I told you, you are having a totally different teaching learning methods here. Some of them are actually skill oriented learning, some practical, some clinical scenario. All those things are, it's a proper blend of different teaching tools that you are getting here. Maybe in the +2 level, sizable portion or a majority of your teaching will be a didactic lecture. The teacher is coming and lecturing there in the class. But here there are slightly different modes of teaching. Definitely the peer pressure, that's one of the very, very, very important thing. We are all concerned because of the heterogeneity of students coming into a class, having different interests. And some of the students are very delicate, easily influenceable. They will get easily, distracted by the peer pressure. And many of the faculty, you know, that they are busy doctors, where they are celebrities in their own field. Many of them are actually appears to be inaccessible to the medical students. We are actually looking into ourselves how to be more accessible to the students, how to be more student friendly in the medical education, or at least in the medical college. Now let us see a learning lag after the NEET. This is a major important thing. I told you in the earlier slide also, the first 3 to 4 months are so crucial. We are actually in a very fast pace in the first MBBS level. And if you are having the lethargy after the NEET, of course, many of you are repeaters. You must have done highly pressurized learning for about 18 hours, 16 hours a day of preparation for NEET. And after getting into the MBBS, many of you are actually so relaxed and so lethargic. You are having your own inertia. So you may sit back and then start learning. By the time, lot of water has flown under the bridge. Lot of portions might have gone past you. So it's be very, very difficult to bring both ends together. So try to be very careful. You should start learning in the very first day itself, not in a lengthy hours. At least you can study 30 to 40 minutes on every day. So small steps will take you to a high place. So make a short sessions of learning every day from the very first day you enter into the medical college. Never ever undergo this particular post-NEET lethargy. Of course, the voluminous topics, I do agree, anatomy, physiology, biochemistry, it's too big compared to your English or history or whatever it may be that you have studied, even the physics that you have studied in the +2 level. It's a sizable portions are there for every sessional exam. So it's good. How to solve this problem? That's very important. You slice a major topic into small modules. That's very important. I'll give you an example. Also, I already told you, when you take the blood from physiology, you can slice them into small things. First thing is everything about the blood as a fluid. Then you can go to the RBC, different modules, RBC morphology, hemoglobin, fate of RBC, anemias. So these are the submodules of a chapter. Similarly, you can apply this particular slicing into all major systems so that you can keep a definite title for it and definite time for it. For example, I will be using only 40 minutes for blood as a fluid. And you just try to complete that particular thing in 40 minutes itself. Initially, I do agree, you may not be able to complete even with 1 hour. It may go to 1.5 hours. Or make next time when you make the timetable, you can give that allowance also. And never ever stuck on to one particular topic beyond a particular time. Go to the next topic so that you can proceed in uniformly in every areas. And another thing is, you have to have an index. As I told you, when you are starting a particular system, keep a piece of paper, make the modules in that particular thing an indexing way. Once you finish it, make a tick against it. That shows that you are rewarding yourself. Oh, yes, I have done the blood as a fluid. Yes, I have completed it. Next, once I start RBC, once I finish the RBC, put a tick against it. So these are all self-rewarding things. At the end of the day or at the end of the week, you know that, oh, this much portions I have done in my last 1 week. A very credible performance. So next time that will be definitely an incentive for you and you will improve further. Now, another thing is 1, 2, 3 rule. This is a major thing. It is being shared by some of my seniors in my Kartha Medical College. When we entered first year, some of the seniors shared this particular thing. Many of you may be knowing it. 1-2-3 rule. What is this 1-2-3 rule? 6 hours minimum you should study in one day before the next academic session starts. That means your Monday evening till Tuesday morning, you should complete 6 hours of study. How to divide it? 1 hour you can give to the easiest subject. If you feel that anatomy is so easy for you, spend 1 hour for it. Exactly after 1 hour, you switch on to the physiology mode. That is the moderately difficult, you can spend 2 hours. Then the most difficult subject, let it be in biochemistry for some students. Spend 3 hours on biochemistry itself. Either a daily lesson learning or advanced learning or a revision that you can do. And never ever stuck on to one easiest subject or one difficult subject the entire day. You will be lagging behind because the timetable on every day, we will be covering all the 3 subjects. This is applicable not only to the first year, it is the second MBBS level also you are having the concerned subject. Always try to proceed in uniformly and give a lot of time proportionate to the degree of difficulty so that you will be progressing uniformly in all the 3 subjects. Now, if you're losing one subject in university exam, you will not get promoted to the next year. You will not get a second chance for that subject alone. You have to pass that subject also. The loss of time is equal. So try to be very careful. All the 3 subjects are equally important. Give proportional time for this. Proceed in your studies in all the 3 subjects uniformly. Now, you know that I told you there are different learning methods, teaching methods adopted here. I told you according to the statistics, more than 60 to 70% of the students are learning by seeing it. And how you can utilize this? Museums, atlas, the dissection table, all these things are very histology slides. These are all important things, the visual information that you are going to get, and you are going to learn a lot from this particular thing. Mind you, that is much more imprinting, much more easily encoded into your brain, much more easily retrievable. So try to depend on this visual learning. Make as many illustrations as possible, as many flowcharts as possible, as many box diagrams as possible on a particular concept. That will give you an easy way to learning, quick learning you can attain, and that is much more long lasting. Some are actually auditory learning. You can keep some of the lectures and listen to the lectures repeatedly according to your convenience, according to the time availability, and repeated it. Some of you are very good auditory learners. Use that particular medium. Some of them are actually examining and doing the skill and learning. And that's why I told you the clinical studies, bedside teaching, OP teaching, theater teaching, emergency medicine or casualty teaching is very, very, very important. And very minority may not have all these things. They are so comfortable with the abstract material that they learn from the printed material or from the wordings that they get from the journal or from the textbook. But mind you, they are the minority. They are too intelligent and too high level of IQ. And a proper blend of all these things will definitely help you in learning. And we are adopting all these things. So try to get acquainted or get adjusted to the different form of learning and find out the different ways by which you are learning easily and in a better way. The museum, I told you repeatedly, this one area, it's being quite underused in most of the medical colleges. Most of the MBBS students are not having, according to the attendance that I'm getting from the museum, it's very thin. And many of the first MBBS students are not keen in attending the museum. So please take care, go through the museum, the gross specimens which is displayed there, the dissected specimens which are kept there, they are all excellent masters in teaching you anatomy. Peer pressure, I told you, this is one of the area where you can get easily distracted and all the priorities will be compromised, all your visions will be abolished, all your goals will be reset. So try to be very cautious about selecting friends and never ever be under the peer pressure. I told you the priorities may be different and the inclination or the interest may be different. So never ever go with that particular mob psychology. I'll tell you, ultimately, you are the only son to your parents. You are the only brother to your sister, or you are the only brother to your elder brother. So ultimately, you are going back to your home, or you are going back to the family. There you are accountable. When you are there in the college, you will be doing all these things because of the peer pressure. But ultimately, you are alone accountable to yourself, accountable to your success, accountable to your defeat, or according to or your ill fortune and all those things. So try to be very progressive, very constructive, and definitely the peer pressure will never ever affect you. You can come out from that. Now let us see The inaccessibility of the faculty, as I told you, I do agree that some of the senior professors, some of the senior faculty members are totally inaccessible, but you don't get distracted by that. So find out a faculty in your department or in the college whom you can easily converse and whom you are actually helping and constructing or giving a positive thought, bringing back to the mainstream, or solving your problems, alleviating your tensions and all. Find out such person there in the college and move close with him and get advice from such persons. So there, the mentor system playing a significant role here. Now, this is one important thing I want to keep it and to stress here: how to write lecture notes. As I told you, the self-directed learning is much important here. In your +2 level, +1 level, the printed notes will be given, or somebody will be dictating notes, and you will be copying it, and it will maybe there and available there in the website. They may upload it, but such things may not be feasible in a medical education where we are dealing with a lot of information on every day. So you keep your own lecture notes, fault it into 4 quadrants as you see here. In first quadrant, you can write the text or the concept. For example, erythropoiesis is discussed in the class. You can write the phases of erythropoiesis, stages of erythropoiesis, factors affecting erythropoiesis in the text component here in the first quadrant. Second thing is, you can bring the probable questions that appeared in the university examination in the previous years. And every portion, there is a potential question which is hidden there. Find out it. For example, in this particular example, erythropoiesis, a very conventional essay question, you can get it. Discuss the stages and phases of erythropoiesis with the help of a neat labeled diagram and add a note on factors regulating it. This is a probable question. You can write that. According to this, every area, there is a probable question. You can keep that particular thing in a different color in another quadrant of the page. The diagram which is related to that particular content, you can keep in the lower quadrant. For example, you can draw the diagram which is so relevant for erythropoiesis. You can show the graph of erythropoiesis that is taking place in the intrauterine life as well as extrauterine life, like myeloid phase, mesoblastic phase, all those things you can show, plus the stages of erythropoiesis you can keep there in the lower quadrant. Now, this is the most important thing you should keep in there. Additional reference point in a different color. You can go through some of the standard textbooks and refer only to that particular area. What additional thing that is mentioned there in that book, which is not discussed there in the class, bring it there. And if that particular thing is not palatable or it's not easily explored, you can seek the help of the faculty who took that particular portion when after going back into the department on the next day. Definitely, if they will try to help you out to crack that particular difficult area, provided you are bringing into their notice by your own reference. At least 2 to 3 reference book you can use for that particular thing. So these 4 quadrants, once you complete it, definitely it will be useful for your PG entrance after the five years when you are preparing for all the 19 papers for your PG entrance within 1 year of period. So this will be definitely a very helpful tool for quick preparation or quick revision of your basic subjects after completing your clinical subjects after 4.5 years. So this is a simple task you can adopt in the writing lecture notes. Now, how to refer a topic from a reference book. You know that many of you are actually totally distracted by so many books that is being discussed there in the class. But I recommend in the first MBBS level, maximum 3 books you can refer. But never ever read one particular whole chapter from cover to cover in the reference book. That will be definitely time consuming. One cannot make a complete thing in this 1 year itself. So how to refer? You refer according to the relevant area which is discussed there in the class, where you want to clarify it, where you want to add something extra to it if you feel. For example, the same example, erythropoiesis. Erythropoietin as a hormone, it is coming from the liver and the kidney. You want to know more detail about the erythropoietin per se. You can go to the reference and you can go through the erythropoietin, its molecular structure, its synthesis, its actions in detail. All those things you can add. In a lecture class, you may not be able to cover the entire thing as far as erythropoietin is concerned, where we are discussing erythropoiesis as such. So if you want to have more marks, more scoring in the university exam, you want to give some extra things, which can be easily get it from a reference book, reference to that particular area. So always try to refer in line with your regular classroom teaching to elaborate on one particular concept, not in a total way. Now, Before coming to the next class, you want to read some areas which is already there, because 1 month schedule or 1 week schedule will be put up there in the notice board ahead. So you can easily refer in advance. And for that purpose, you can use a reference book, and you just have a background knowledge. You just prime yourself, be there in the class. That will be definitely helpful for you to understand the concept in a detailed way. And you can easily screen out the unnecessary fact that you learn from the reference book when you listen to a experienced teacher. There, they will be discussing only the must-know criteria or must-know knowledge. So the extra knowledge that you learned or you read it from the textbook, you can afford to forget it, or if you want to give it, of course, it's well and good, but you know which are the thrust areas just by having a background reference or background idea before coming to the next class. Now, multiple books are always, I suggest, because depending on the author's interest or author's what you call idea, they may go in a very detailed manner in one particular area. For example, Guyton, physiology, I'm quoting from my own specialty. He is giving a lot of experimental details about cardiovascular system, which is not so essential for first MBBS level. So never ever get distracted by that particular book alone. Read another one, and or maybe third one, where the common things are explained in a nice way in all the three books uniformly. You know that that is the most must-know criteria as far as a first MBBS student is concerned. And all the other things which is unique for one particular book, definitely it may be in the nice-to-know criteria or maybe a desirable-to-know criteria. It may not be that important for your university examination. Of course, it is very important for acquiring more knowledge or helpful for your clinical practice. I do agree that, but this is the advantage of having multiple reference book for a particular topic, not in a cover-to-cover way. On a particular topic, you can find out which is the must-know criteria or must-know area, or which is the desirable-to-know area. Now, these are the tips of learning I want to tell. And anatomy, physiology, biochemistry, always you go for a horizontal way of learning. Take anatomy first, finish the functional anatomy, discuss the physiologic essentials of that. Then you can, if you can add the biochemical element also into it. So always try to find out a slot for integration of all these three subjects. Then you can have a vertical integration. And for example, neuromuscular junction is discussed in the class. You have drawn the diagram, you have studied everything, but retrospectively, you study that particular topic as far as the disease is concerned, like myasthenia gravis. Myasthenia gravis is a disease which is affecting the neuromuscular junction. So study the myasthenia gravis, and you can study the neuromuscular junction in detail. That will give you more idea about the drugs acting on the neuromuscular junction, the mode of action, the transmission across the neuromuscular junction in more detail, once you find a relevance in that particular topic. So always go for a vertical form of integration or horizontal form of integration. Never ever stick for a long period of time. I'll tell you, maximum 40 minutes is the span of attention for any adult or any medical student. Break the sessions into small things. Small learning sessions you can keep a particular target in that period of time, complete it and break for a while. 10 minutes break, then the whole thing will be rejuvenated. Your neurotransmitters in the brain will be resynthesized. Your neurons will be totally, what you call, erased with unnecessary impulses. So it will be clean again, and again you can recharge your neurons. You can have a workable timetable. That's very important. I told you 1, 2, 3 rule. You can apply here. 6 hours a day. Either you can do it on the same day, evening, before going to the bed, and next day morning you are freshening up and you are coming to the class, or you can divide 4 plus 2, 4 hours on the previous night and 2 hours in the early morning next day. I prefer to that, because early morning learning is much more productive, because your brain is so fresh and the neurotransmitters are very fresh starting from the base level. All unnecessary eddy currents in the neurons or in the brains are completely erased after you are a good sleep. So you can easily encode the memories in the early morning learning. So I always prefer or suggest early morning learning rather than a late night learning, where you are handling a very fatigued brain. And charts, box diagrams, flow charts. I told you, because the visual learning is more impressive, easy way of learning, quick learning, and large portions can be covered in a given period of time. So always make some visual clues for memorizing a difficult concept. Now, must know, this is a very important thing. In a first year student, you may not be able to identify which is the must know criteria on a particular portion. There, your lecture class will help you a lot. If you are missing a lecture class and opening a standard book, you will be totally lost. You don't know which is the area in the must know part. you will be totally getting diluted with the voluminous information that you are going to read out from the textbook. If you are attending a class on that particular topic, you know that which is the must know criteria, which is being narrated by the teacher or by the instructor. So this is a way you are correlating with your reference and the classroom. So try to focus on must know. And after studying that, you can go to the desirable or nice to know areas of your concept. Daily lessons is very, very important. Before coming to the next class, you read the daily lessons on the same day or maybe at least before the next class. Otherwise, your memory will be totally getting tapered and tapered and tapered, and finally you will be having nothing related to that particular thing. But when we are discussing a lengthy system, it is a mega serial, and we will be discussing one particular class in continuation of the previous one. And if you are not freshening up that particular thing, definitely you cannot bring both chains together. You will be totally having a gap, and that will add up to an aversion towards the next attending the next class. Unless you are having a continuity, you will not attend the next class. Just like watching a mega serial, if you are not having a recap of the previous episode, you will not have an inclination to attend to see the next episode. Exactly, you can equate to a larger theory class. It's always a continuation of the previous one. So read the previous lessons and come prepared for the next class. You will be really enjoying the session. You will be able to get a complete concept of that thing by adding the information that you gathered in the previous class. Now, weekends revision is very important. So every weekend, I told you, just this is one way of getting rid of your homesickness. You can keep a target in the weekend and revise all those portions in the weekend that you have studied in that particular week in all the 3 subjects or all the subjects of that year. Pending works, writing assignments, writing records, drawing diagrams, all those things you can keep it for towards the weekend, complete in that weekend itself, so that the next weekdays will be very productive. You can utilize it for the daily lessons and also for your adding up knowledge. And you are keeping a record writing and all those things on the weekdays, you are compromising the daily lesson learning. So always keep pending works towards the weekend. Now, tips of writing examination. These are the simple things which you have already learned in your school times. I'm just brushing up once again. Read all the instructions in the admit card. This is very important. Many of you are totally ignorant about the instructions of university regulations regarding the conduct of examination. That will bring you a lot of stress. That will bring you problems. Now, keep all the essentials on the study table on the previous night. This is a very, very simple advice. I want to keep. What are things you should keep there on the table on the previous night? Pens, pencil, eraser, admit card, and identity card, all those things. So you feel so silly about it. This is actually from my own experience. Many of the time, at least more than 10% of the students are coming to the examination hall without an admit card, without an identity card, without an eraser. All those things will keep you in a tense state. And if you're keeping it in a haphazard way in the room, on just before going into the examination, you will be searching desperately here and there. That will add up to your stress, add up to your tension. I'll tell you one thing, the stress can erase almost 10% of your encoded memory. At the same time, a calm mind, a peaceful mind can retrieve more than 10% of the stored memory. So it's very, very important studying, and keeping everything in a haphazard way. You are putting yourself into a complicated situation where you are having your own stress. See, the effort that you have put in your study leave, it is not going to be utilized to the full extent what is expected. So please keep these small things in mind. Before coming to the examination hall, keep everything ready. So you'll be having a very peaceful, calm mind as you come to the exam hall. And always follow the university regulation in the examination hall. That will definitely keep yourself calm and quiet. You may be able to retrieve excellent stored memory in a convenient way. Relax 15 to 30 minutes. You are, for example, exam starts at 9:30. You can be there in the exam hall by 9 o'clock. 30 minutes is enough to relax yourself. Definitely the whole thing will be calmed down. All unnecessary thoughts will get erased, and all the memories will be totally freshened up and stored, and it is easily retrievable. So relaxation is very, very important. And read the question paper once or twice. This is very, very important, because one word may be ambiguous. One word in your question may be so tricky. That will create a lot of problems. So repeat the question or read the questions repeatedly and get a good grip on that. This is very important. Then time management, you can have a rough management after going through the timetable, question paper itself. Allot certain time for essay, allot certain time for short essay, allot time for draw diagram and all. you can have a small mind map about the time you are going to allot and go according to that. Structured essay question, if there are subdivisions in the same question, answer to those subdivisions, not like a voluminous single body answer. Suppose, for example, erythropoiesis structured essay came. One sub question is draw and delete label diagram of erythropoiesis. You give that particular question, answer to that. Discuss the factors regulating erythropoiesis. Write the question and answer to the regulation factors. And the third subdivision is something else. So like that, you answer in a separate body so that it's easy for us to value, and that will definitely add up your quality, the value addition to your answers. Now, another important thing is don't waste too much time on the question which is totally strange to you. It is a waste of time. And you will be compromising the time which you are actually going to use for your known question or known answer. Don't make any blunders in the answers. This is very important. That will be counterproductive. If you are making a big blunder, definitely the examiner will be having a different mindset. He will be valuing you even for a good answer in that particular perspective. So never ever try to make any blunders. If you are absolutely having no idea, be silent on that particular concept rather than bringing blunders. Short essay question, as I told you, you make an index. What are the points you are going to include in that particular essay? For example, a short essay is discuss the mechanism of neuromuscular transmission. For example, this is the question. What you are supposed to write? You write the headings in the beginning as an enumerated list. Diagram of neuromuscular junction, mechanism of neuromuscular transmission, drugs acting on neuromuscular transmission, applied aspect. So 4 points are there. You give a list of that 4 points in the beginning. Then you write one by one in a subheading. What is the advantage? If you are not able to complete your answer, your points are already there. So the person who is valuing, oh yes, this particular student knows this particular concept. He is not having enough time to narrate all those things. Definitely only minimum a percentage of loss of mark will be there. You will be getting almost 70 to 80% of mark, even though you are not able to complete that thing. And any scope for diagram, you include the diagram in the beginning itself, rather than keeping the diagram towards the end. You may not be able to complete the description part effectively. You may not be able to complete the diagram effectively. But if you're keeping diagram in the beginning, yes, your answer is almost near complete. Even though you are missing some points in the description, if it is there in the diagram, no examiner will reduce marks. So always go in the order of listing of important points first as a list. Second thing is diagram or box diagram or flow chart. Then only the description or the text is included. So follow this particular order, my dear. Never break the answers into different areas. This is one of the things that we quite frequently see. One particular answer will be there in one part of the answer sheet. Another part of the same answer will be in another area. It will not be valued. So if you want to keep one answer, it should be in N block. You leave a space below that answer, come back to that area, fill it up or score it out. This is never ever break the answer in piecemeal in different areas or in different portions of your answer book. Give space below it and fill it up later, or you strike it off. Draw diagrams, only draw diagram is important. If the question tag is draw diagrams, never ever include any descriptive. You are wasting time and you are not going to get any added benefit out of it. So please be answer to the question. Now, we have actually had a quick journey, a movement or a transition from Dunce, it's me, to a doctor like you. And the qualities that we have addressed, the stupidity, the disorganized, careless, idiot, and irresponsible, non-focused, Dunce, into a dedicated, determined, disciplined, knowledgeable, skilled, compassionate, empathetic, professional doctor. You are going to be one of that kind. I'm 100% sure. Wish you all the best, my young friends, and all those who actually gave me a patient ears, eyes, and brain to this particular session. All the best. Thank you a lot.
Thank you, Dr. Sir. It was a comprehensive and insightful session. Your years of experience, your depth of understanding about the course, and your ability to present on the subject in such an interesting way have produced one of the most productive sessions for all of us. I'm sure your valuable points will definitely shape us into role model doctors that you envision. Now, it is an opportunity for all the dear attendees present here to ask your doubts and questions to our Dr. Sir. Please feel free to ask any questions related to the MBBS course and Dr. Sir will definitely try to address all your concerns. Those who would want to ask questions, please use the hand raising feature in Zoom and we will randomly pick one among you. So please use this opportunity to
Yes, Nishant. Nishant. Hello. Exam is in May, I think.
Sir, I don't know about the schedule.
So usually the general trend in all the medical colleges for the 2020 batch, pardon? You will be having sessional exam in May, if I am not correct. If I am correct, I think all the portions taken till that time will be there for your sessional exam. So go in a systematic way. Start your timetable now itself. Allot, as I already told you, apply your 1, 2, 3 rule and give the proportional time for all the 3 subjects and make a timetable, make a self-accountable targets, short-term goals you can design and proceed in a comfortable way, in a tension-free way. So the most important thing is you should convince yourself that you have done something. You have justified yourself. So that will create a lot of mental peace that will definitely improve your performance in the exam. And if you are keeping yourself in a tense state, though you after your heavy, hectic studies, definitely it will be counterproductive. So do it in a systematic form. That's very, very, very important thing. An organized plan of action for the next 2 months. Okay, anybody else? There is another question, I don't know, from Vivo V19 to everyone. I think preparing NEET PG from the first year itself, 100% you are correct, you are in the right track. As I told you, you have to have short-term goals and long-term goals. One of the long-term goal, which every first year student keep in mind, that I should get a postgraduate seat in some of the central government institutes like AIMS, PGH Chandigarh, or Velu, St. John's, or even JIPMA. So that should be the long-term goal. And for getting into that, definitely a solid foundation is required. So you prepare from the first year onwards and go through the multiple choice questions and problem PBL pattern of questions module wise as you proceed in the first year topic. So that's very, very important. As much multiple choice questions as possible from chapter wise once you finish that particular area. So this is how you are going to prepare for the PG entrance. So going through the multiple choice questions, you will be exploring that particular area in much more detailed way, much more intricate fashion, and you know which are the important thrust areas in that particular chapter. So there are advantage for getting yourself familiar with multiple choice questions. So you can start doing multiple choice questions now itself. That will be definitely a stepping stone towards your PG of your choice in some of the pioneer institutes of the country. Thank you.
Hello, sir.
Please.
Good morning, sir. I'm Agnivo Chatterjee from Sri Ramachandra Medical College.
Yes, thank you.
First of all, sir, I would like to say that it was really a very good session, sir. I really liked it.
Thank you.
So, sir, my question is that I'm a first year student, sir. So, in all the subjects like anatomy, physiology, biochem, we have so many different books from various authors. Suppose if I take physiology, for example, we have international as well as Indian authors. So, sir, maybe in one book, there may be the diagrams may be given like very easy to understand, whereas in some book, the processes may be given as flowcharts. So, sir, how will we understand that? It's not possible that I take 3, 4 books and start reading, right? So, how will we understand that which book is actually the correct book for me?
Okay, okay. It's a very good question. It's being asked by many of my students in my previous years. It's a very relevant question also. My dear student, the only an answer to that particular question is never ever get distracted by others. So the ultimate reference, ultimate what you call the essential thing that you should fully depend on is your classroom learning or your classroom teaching. And whatever diagram it's being projected on the wall or as a PowerPoint or shared by your faculty member for that particular topic is the most core concept or a core thing that you should depend. There is no compromise on that. Then you can actually depend on first MBBS, you can depend major part on one particular book where there is a proper blend of all these things. Suppose if you feel that your flowchart in one particular diagram is excellent, so you can depend on that particular book plus the diagram that is discussed there in the classroom or in the teaching hour in a conventional class. So this is the easiest way. As you rightly mentioned, you are going through, you are moving from books to books, author to author. Definitely, it will not take you anywhere, and it will be absolutely waste of time. And finally, you will not be having a clear idea about it, and you will be totally distracted. So what I suggest is make the core learning material, the information that you get there in the class that is being shared by your teacher or the faculty, who has actually might have done lot of reference for making a material for your class. That particular reference he or she might have done as a preparation phase. Plus, you can depend on one particular book where you are actually feeling comfortable with optimum blending of all these things that you said, the concept optimum, diagram optimum, and the flowchart optimum. One particular book you can depend, plus your classroom teaching, definitely that will definitely help you. For your micro reference, as I told you in the example, for example, if you want to know one particular area in a depth or in a deeper way, there you can go through 1 or 2 different books, not for the entire concept as such. I hope this is a satisfactory explanation for you, my dear. So I think there is no more queries or no more interactions now. So I'm very happy to interact with my young friends. I'm so thankful and grateful to the eDrona, the digital platform, for creating such an opportunity to address you and all, to share some of my thoughts. I hope this particular session was useful for you and you have at least a few takeaway home message from this session. Thank you once again for each and every one.
Dear attendees, we have now come to the end of the session. I'd love to take this opportunity to thank Dr. Gopakumaran sir for spending your valuable time from your hectic schedule for all of us. I'd also like to thank all the dear students who have attended this webinar. And on behalf of Dr. Sir, I hope it was a productive session for all of you. Thank you once again, and we look forward to seeing you with our future webinars. Thank you very much.